And welcome back to the Factor Uncensored. Respiratory viruses cases children are climbing. As cases rise, pediatric hospitals are being pushed to the brink. Right now, more than 70% of the country's hospital beds are taken. The problem, the virus is called RSV. Dr. Danish Ali joins us here on the Factor Uncensored from the Archpoint Pain Institute. Glad to have you here on the Factor Uncensored. Doctor, what is this that children are dealing with now? I know we've dealt with COVID, obviously flu, but what is this?
So this is a respiratory virus that a lot of kids get. Historically, a lot of these kids that grow up, we get this. And because of COVID, because of our efforts with keeping kids, clean, hygiene, and all of these things we were doing, what happened is that they did not build immunity to this virus, right? It's like the flu. It's like the common cold virus that we get. A lot of kids develop this. However, with COVID, with everything that's happened, we did not get that immunity. And now because of that, now that we're entering the fall and winter seasons, the cases, this rises in RSV happens historically, and now kids cannot fight that infection on their own. And that's why they're ending up in the hospital.
So is it like a missing generation where this generation skipped what we all went through, the basic flu, the basic cold, and now it's catching up to them, but it's taking a toll?
I wouldn't say it was a whole generation per se, Isaiah. I think it's been the last couple of years with COVID and with us, doing a great effort of trying to kids clean in terms of their hand sanitizations and all of those things. It added up into all of that. And so now we're at this point where kids have not built this immunity to this virus, right? Viruses, we build immunity over time. And so because of that, now that's why we're seeing those cases rising in the hospitals. And otherwise, historically, these were mild cases. It was like the common flu. It was like the cold. You got a little bit of a runny nose, a virus, or a cold, a cough, and it went away. But now that we don't have the immunity that we've necessary for this, we're seeing those cases rise.
And so how are hospitals and doctors like yourself dealing with that?
Yeah, so a lot of testing is happening right now because a lot of the symptoms of RSV look and mimic the flu, COVID, and so a lot of testing is happening currently as we speak, number one. Number two, what we're doing is getting these kids breathing treatments. So breathing treatments and also antiviral medications to help them for their lungs and for their bodies to be able to treat and to be able to get over this virus.
And for the average parent out there who may be watching, what does it look like? What does it feel like? When should they get concerned as a parent?
Right, so anytime you see flaring of the nostrils, you see abdominal breathing in these babies and kids, you see a decrease in appetite, maybe the kids aren't eating, maybe they're crying excessively. Those are kind of some of the symptoms and signs that you worry about, and that, especially if folks who are less than 6 months of age, those are the kids that you want to be really cautious of because their lungs have still not fully been built, and they're still in that kind of like a recovery mode where they're still trying to build up their lungs. And so
when we hear treat the symptoms, is it the same with kids, or should you get them to the hospitals?
So treat the symptoms initially unless you start seeing some of these symptoms. Again, most of the cases have very mild symptoms. They're just a cough, the runny nose, the sneezing, and it's self-limited and it goes away on its own. But when you start seeing those other symptoms, we talked about the flaring nose, the decrease in appetite, excessive crying, decreased sleeping, those are when you need to get worried and get to the patient's pediatrician.
And so as a parent, how can we protect our children to make sure they don't get it, or at least try the best we can?
That's correct.
To make sure they can't get it.
Hand hygiene is very important, Isaiah. Kids that are sneezing, remind them to cover up, washing your hands constantly, keeping that hand sanitizer around, and just keeping those safe precautions in place constantly. That's what we can do it, because these kids are now in school. We're going to see some of these cases rising, especially with now the winter months coming. COVID is going to rise again, as we know historically, and so it's important for us to be cautious of those things and keep hygiene as our number one precaution.
Okay, Dr. Danish Ali, Archpoint Pain Institute, thank you for coming in. It was work getting you here on a Friday night, but we got you here.
We're here.
Thank you, sir.